Okay, combining everything we know, the short definition of addiction is that it is a primary chronic disease of brain reward, motivation, memory, and related circuitry. Dysfunction in this circuitry leads to characteristic biological, psychological, social, and spiritual manifestations. And addiction is characterized by an inability to consistently abstain, an impairment in behavioral control, diminished recognition of significant problems in one's own behavior and interpersonal relationships, as well as a dysfunction in emotional response. Now, like any other chronic disease, addiction can be characterized by relapse and remission, and unless adequately treated or if the addict gets involved in recovery activities, it can be progressive and lead ultimately to disability or death. Okay, some of the factors that are believed to contribute to the appearance of addiction in individuals, as well as its characteristic biopsychosocial and spiritual manifestations, include, firstly, the presence of an underlying biological deficit in the function of reward circuits, the repeated engagement in drug use or other addictive behaviors causing a neuroadaptation of the motivational circuitry, leading to impaired or lost control. Then cognitive or affective distortions, which impair perceptions and compromise the ability to be able to deal with feelings, and this results in what we know as denial or self-deception. Disruption of healthy social supports and problems in interpersonal relationships. Exposure to trauma or stresses that might overwhelm an individual and their ability to cope. Distortion in meaning, purpose, and values that would guide our attitudes, thinking, and behavior. Distortion in a person's connection with self, others, and a transcendence, or as some refer to as a higher power or God. And then lastly, the presence of a co-occurring psychiatric disorder. Okay, so firstly, just as we touched on before, addiction is characterized by what is referred to as the ABCDE, and that is an inability to consistently abstain, an impairment in behavioral control, craving, diminished recognition of significant problems in one's behavior and interpersonal relationships, and then lastly, a dysfunction in emotional response. It can also have a significant impact on our executive functioning, and in this it can manifest in areas like perception, learning, impulse control, compulsivity, and judgment. People who have addiction will often manifest a very low readiness to change despite mounting problems and issues that they are confronted with by friends, family, and loved ones. They will often have a huge lack of appreciation for the size of the problems and conditions that are occurring around their addiction. And it can also manifest in other behaviors, and some of these include excessive drug and alcohol use at higher frequencies or larger amounts than originally intended, excessive time loss due to alcohol and drug use, and especially recovering from alcohol and drug use that might have an impact on social responsibilities like work, family, and school. Continued use or engagement in addictive behaviors or using substances despite serious physical or physiological damage or problems or complications caused by the drug and alcohol use. And then a narrowing of behavioral repertoire, and that's from focusing on the rewards that are a part of addiction, so far less capability to function on a behavioral level, and then an apparent lack of ability and or readiness to take consistent ameliorative action despite the recognition of the problems that are being caused. Okay, some of the cognitive changes that we can see occurring around addiction are, first of all, the continued preoccupation with substance use or other addictive behaviors. Then also the altered or unrealistic evaluation of the relative benefits and detriments gained from substance use and other addictive behaviors. And then lastly, the inaccurate belief that the problem in one's life are attributable to other causes and not a predictable outcome of addiction. Some of the emotional changes we see happening around addiction is, first of all, an increase in anxiety, dysphoria, and emotional pain. Also, an increased sensitivity to stresses involved in the recruitment of brain stress, and this can lead a person to see things as more stressful than they actually are. Then a difficulty in identifying feelings or differentiating between feelings and bodily sensations of emotional arousal, and also an inability to be able to describe or identify feelings to other people. This is sometimes referred to as alexithymia. Genetics is also a popular theory, and it is believed that genetics can account for up to half of the likelihood on whether a person will become addicted or not. Some believe that environmental factors can also interact with a person's biology and determine the extent to which genetic factors will exert themselves. It is also believed that resilience that is acquired either through parenting or later life experience can also affect the genetic factors, as well as culture and how people are raised within certain cultures, especially if they have biological vulnerabilities, can also have a higher likelihood or susceptibility to addiction or other addiction-related manifestations. Now, when we refer to spiritual factors, I guess it's easy to get carried away and get off track. But if we go along the guidelines of what 12-step fellowships are saying, to keep it really simple, spirituality refers to two key areas. The first area being a way of life. So if we say that a person is spiritual, they practice a spiritual way of living, which is where they place the needs or try to place the needs of others ahead of their own, and they live on altruism, and they try to practice what they call spiritual principles in all their affairs. Those principles being things like love, acceptance, forgiveness, tolerance, and so on. Now, the second of those areas is where they refer to a relationship with a transcendent or a power greater than oneself. And that can refer to, but is not limited to, religious beliefs or practices. It can also refer to any kind of power greater than oneself. And they believe that the two are interlinked. So if we keep it really simple, what they believe is that manifestations of addiction such as fear, anxiety, resentment, or anger, or even things like shame or self-pity and so on, are really manifestations of a spiritual problem and not a physical or psychological problem. So if you take a look at a spirit, it would kind of be seen as the same as on a physical level. If a person is physically unhealthy, and as in they live a very unhealthy lifestyle, they don't exercise, they don't eat healthy, and so on, or they take drugs and alcohol, the physical body would be quite ineffective and not very effective in coping with life. And much the same on a spiritual level is if a spirit or a soul or chi, as different people would refer to it as, was harboring things like anger and resentment and fear and so on, the spirit would also be quite ineffective, and that would manifest in how the addict copes with their life in all of the areas, similarly to those we've already discussed. So the idea here is that if they were to go through and deal with, or as they refer to, clean house, and get rid of all the negative aspects of their spiritual self, that the spirit would become healthy and be replaced with more positive manifestations like love and acceptance and so on. And as a result, the physical and psychological manifestations of the disease would cease to exist, and the obsession and compulsion to drink and use, as they refer to, would be lifted. So just lastly, to cover what is probably could be a very large topic, to keep it very simple, treating addiction needs to have a multidisciplinary approach. as there are so many areas that are affected by addiction that any one single approach is never really going to be as effective or really have the kind of success that you want to achieve. So an approach that would cover the physical manifestations as well as the psychological and the social as well as spiritual would probably be, and is evidence-based, is the most effective way of treating addiction. Okay, let's take a look at the criteria for abuse, dependence, and addiction. Now, these are seen as three separate entities, although the addict may experience the symptoms of both of the other. Neither a substance abuser or a substance dependent will experience the symptoms to a degree that an addict does. So if we take a look at those three, and just to explain briefly, if we look at substance abuse, what we're saying is that just because a person abuses a substance for a period of time, but not continuously, it doesn't necessarily make that person an addict. So many people drink excessively, and this might cause physical problems like liver damage, but if a sufficient reason came into effect that they needed to stop or moderate, they would be able to do that because they would have a decision in the matter. They wouldn't have the compulsion, they wouldn't experience the craving, and so on, and so they would have the ability to achieve that ideal. However, if we take a look at dependence, a person who, and I use the term loosely once again, a normal person who was to take a substance, let's say for example like morphine, an opium-based substance, opiate, if they use that substance for let's say 6 months, they would still develop tolerance. They would also experience withdrawal symptoms if they stopped using it, and they would also go to great lengths in order to acquire the substance because they have a fear of going through the withdrawal symptoms that are going to occur. But this still doesn't necessarily class them as an addict. When we look at addiction, we're looking at a whole different ballgame. So if we take a look at the criteria, or the 4 C's of addiction, and the 4 C's, or what is referred to the 4 C's of addiction, are control, consequences, compulsion, and craving. So a loss of control over their drug or alcohol use, continued use despite knowledge of harmful consequences, obsession and compulsion to use. And when we look at compulsion, compulsion is when we act on a behavior or using substances to relieve ourselves from physical stress or emotional stress and pain. And it's not the same as an impulse. An impulse is when we act on something without considering the consequences, which is also true to some extent. But if we take a look at the last one, then physical craving, as we've now described, it's not as simple as an allergy. It's what's occurring in the brain, in the reward system, when addicts when addicts ingest minor mood-altering substances. Now, it also says there that this will exceed 12 months. So by the time a person figures out that they are an addict or have a problem with addiction, the problem has probably been occurring for a very long time. It will not be less than a year. It will probably span from anywhere from 2 to 5, 10, 20 or more years. Now, if we look at the criteria for substance dependence, it says should not exceed 12 months. So although it might recur maybe once or twice, but not many times in a person's life, it will only last for a short space of time. And the criteria here is tolerance and withdrawal, as we discussed before. And then the substance is often taken in larger amounts or over a longer period than what's intended, and that is because of the tolerance that is occurring. There is a desire but unsuccessful efforts to cut down or control the substance use. And again, this is because of the fear of the withdrawal symptoms that they're going to experience if they do. And then a great deal of time is spent in activities necessary to obtain the substance, again, fear-based, because they will not get the kind of script that they need, for example, from one doctor. So they will also go through or exhibit behaviors like moving from one doctor to another, or manipulating professionals into getting scripts and so on. And then lastly, important social, occupational, or recreational activities are given up or reduced because of the substance use, and that is because physically they will be incapable of keeping up with all of those activities. If we look at the criteria for substance abuse, again it says should not exceed 12 months. It says recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. Recurrent substance use in situations that are physically hazardous. Recurrent substance-related legal problems. Continued substance use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of the substance. Okay, so if we look at those three, as we said before, an addict will go through abuse and dependence on their road or journey towards real active addiction. But people who experience substance dependence or abuse will not go to the lengths that addicts do. Okay, so just to do a brief overall summary of some of the primary characteristics that we've looked at relating to addiction. The first is compulsive use, and as we said here, the addict acts out on an addictive behavior or uses substances not only to achieve pleasure but also to find relief from emotional stress or pain or fear, anxiety, and so on. And this is what reinforces the continued use of substance or acting out on addictive behaviors. In physical craving, as we said, it's more than simply an allergy. It is when powerful signals are sent to the pleasure and reward centers of the brain, and this gives the brain intense signals that it needs the drug or the behavior, and the addict will find it almost impossible to ignore this, as the second part of it is withdrawal symptoms also occur once they stop using the substance. And the fear of these withdrawal symptoms especially, and the discomfort and pain that will be felt in going through them, also causes the addict to continue to use. Then loss of control, and as we said before here, the addict might plan to use only a certain amount, they might plan to only spend a certain amount but can never really follow through with that plan. They'll always use more than they intended to and spend more money than they intended to. Then continued use despite adverse consequences, and as we know, addiction has many consequences, and as those consequences pile up, it strangely enough will be more apparent to the people around the addict and not to the addict themselves how serious their problem is, and this is because of denial. And the addict will then give justifications or other excuses or blame in order to justify their continued use, regardless of the circumstances or consequences. Then tolerance, and simply what happens here is the body's defense mechanism is that when we use large amounts of drugs or alcohol over a period of time, the body will adapt to that use and try to cope with the amounts we're using, and so the desired effect will not be achieved, and they will need to use more and more substances in order to achieve the desired effects. And the last is withdrawal. And withdrawal symptoms, when felt, are generally the opposite to the effects produced by the drug, and are very traumatic and can be very uncomfortable and stressful and painful for the addict. And so rather than go through this painful experience, the addict will continue to use.